Hi, this is Dr. Bernardo. I hope first and foremost that you had a fantastic holiday and wish you a happy, healthy 2021. It's no secret that the COVID numbers in our community and surrounding neighborhoods are a concern. We've been doing our very best to keep the community spread from impacting our schools, but remain determined to use every tool at our disposal in this fight. To this end, South Huntington is going to be the first school district in the region to offer free of charge, completely voluntary testing to any student or staff member in our district. With this in mind, we've contracted with House MD, which will come on site next week and use their nurses and doctors to professionally test any wildcat who so desires. The test, which is rapid in nature, takes only a moment, and you can immediately leave, and what we'll do is we'll call you if your child or staff member is positive. We'll then also email you the test results just so you have a double check. Our plan is to be as customer friendly as possible and use weekends and evening time to avoid any impact upon the virtual instructional day. We also plan to remain incredibly flexible and do things such as adjust schedules so families with multiple children in different buildings can simultaneously get tested rather than come back again and again. The bottom line is that we're offering this testing as a service in the hopes of assisting families, staff, and the health department with their quarantining and remote decisions, and instilling confidence in the community that we're doing everything we can to get to the bottom of all infection and keep our students and staff safe. In a moment, Dr. D'Elia will come on and outline the schedule, as well as the logistics for the testing. The bottom line is that the professionals from House MD will be doing the testing, and they'll be here every single minute of the way, but we'll be here as well for support with you. All of our administrators and staff will be here as well. The testing plan is new to all of us, and we understand that questions will arise relative to logistics associated with the testing of what could be 6,000 or 7,000 students and staff members. Trust me when I say that there were many of our colleagues out there who are wincing at the thought of this type of operation and point to everything and all the fears of the things that could go wrong. Everything from rapid testing not being as accurate to all the reasons for the interactions and all the reasons for crowds and lines and all those things. But we just think it's too valuable an opportunity to get this data to run away from it because it's got a few challenges. So we're going to be on testing this Saturday from 9 a.m. to 4 p.m. at Walt Whitman High School. And we ask parents to try and go by the hourly schedule. In other words, we're going to be posting an hourly schedule so we can avoid lines. It's also critical that you fill out the HIPAA forms that are included in the link that we're going to be sending you. That pre-planning will really cut lines down, really ensure equal access, and really ensure that things are flowing. Of course, we'll never deny any student or staff member a test, and we'll do everything that we can to make sure families are included and feel comfortable. The bottom line is that this is an incredibly valuable opportunity that could truly help us intelligently bridge the gap while we await the vaccine's arrival. You'll see from Dr. Lear coming on in a moment that his son and I have actually taken this gentle swab test, and we're going to do it on camera so you can see that it's what they call a minimally invasive test. We have the potential to do something special here by putting politics aside, theories aside, philosophies aside, opinions aside, and really just banding together, getting ourselves tested, and finding out what we've got to deal with going forward so we can make sure we bridge the gap safely. And we know if we have the right information, we can be very, 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 very efficient. Please follow the schedule that Dr. D'Elia is going to talk about. Please ask us any questions. New to us, right? We're working on it. We're trying it. We're going to get it right. We just want to be a little bit patient with each other. We're going to begin on Saturday. We're not going to impact any instructional time. We're going to be flexible with when people come, but ask that you follow, if you can, you follow the hourly times, and we'll be back in touch. Be well, and have a great day.
Hello everyone, this is Dr. D'Elia, Assistant Superintendent for Business and District Operations. I hope everybody's enjoying the holiday season, even amongst the circumstances. Today I just want to speak with you briefly about our COVID schedule and our COVID testing and go over a few of the logistics. First off, I'd like to look at the schedule here. We're going to begin this Saturday, January 2nd, where we're going to begin with Walt Whitman students and staff members. Then we're going to move to Sunday, January 3rd, where we'll take care of students and staff members at Stimson. On Monday, we're going to start with our elementary schools over at Oakwood and Countrywood. And then on Tuesday, we'll go to our intermediate schools with Birchwood and Maplewood. And then we're going to end on Wednesday, January 6th, with our Silas Wood students and staff members. Now, if you notice here, we have the 7 different buildings scheduled. But I want to give you an example of if you have 3 children. One attends Whitman, the other one attends Birchwood, and the other one attends Oakwood. Instead of you making 3 different trips, you could take 1 trip to Whitman and have all 3 of your students tested, if you so desire. If you want to make 3 trips, that's on you. We're trying to make this as easy and as painless as possible for everybody. And we're also, if you notice in the schedule, there are time slots, and they're also based on the first letter of your last name. The reason why we're doing this is so we can avoid any crowds, any long lines. So we're trying to keep this process flowing and moving so we can expedite this test as quickly as possible. Now, it's very important in the email that Dr. Bernardo sends you, there will be a link in there. And there will be a link to a form. There will be some HIPAA forms that need to be filled out. And we need to make sure, if you're planning on getting a test within the district, you need to fill out those forms prior to showing up at the testing site, whatever school building you're going to bring your child or children to. So that will help also move the process along in a very efficient manner. Once your child takes the test, they will leave the facility, and then at that point you will receive a result from an email. The email that you entered into the form within the link, that email will receive the result of the test. So that will come at the end of the day. Now, for example, Whitman's ending at 4 o'clock on Saturday. The email will probably arrive around 5 o'clock. And if you're looking during the week at the elementary schools where we end about 8 o'clock, you'll probably receive the email between 8:30 and 9 o'clock. You'll get that email sent to you. In the event of a positive test, a staff member from House MD, which is our contracted group, which will be performing all the tests, will be reaching out to you a lot sooner than the end time of 5 o'clock or 9 o'clock, probably within a half hour to an hour of the actual test. So that is what we're aiming to do. We hope that you will participate in this because this will give us excellent information as we move forward as a school district into the new year. Thank you.
So the next step in the process, and we have the president of the company that we're using, and we're very, very excited. We'll have him introduce himself. We have the doctor who's managing the operation for us, and we have our team. And what we wanted to do right now was have the doctor do a quick swab on me, and then Dr. D'Elia has volunteered, and we're not sending this out, so no one's getting a test for free or anything like that, but Dr. D'Elia, I didn't want to make anyone else's kid volunteer, so Dr. D'Elia has his 2 children who will volunteer, just to show you that it's fine on a little kid, it's fine on an adult. It's not the more obtrusive test, and that's what we are. So again, we love our community, but we want to make sure we do this right. Doctors and Mr. President, did you want to just give a quick...
Sure. How you doing? My name is Dan Rayo. I'm the president of Onsite Medical Solutions, and this is Dr. Muehlbauer. He's the medical director of our laboratory. He's also the chairman of the ER over at St. Francis Hospital. It comes with a large array of credentials, so if you just want to introduce yourself real quick.
Hi, I'm Dr. Muehlbauer. I'm the Chief Medical Officer at Onsite Medical Solutions. I'm also the Chairman of Emergency Medicine at St. Francis Hospital. My background before becoming a physician was actually as a virologist. I got my PhD doing microbiology and immunology. And after that went into medicine, and I spent some time where I did my medical training at Harvard Medical School, where I briefly was engaged in research there before coming to our area here and setting up medical practice. Unfortunately, COVID has really changed our approach to all things medicine, education, and we're looking to keep our children healthy, keep them in school, and keep our education, our communities humming as best as possible. And I think your school district is doing a phenomenal job with their planning to keep everybody safe and to keep the schools open and functioning well. Part of that plan is going to be testing. And our group, On-Site Medical Solutions, has contracted with several of our local districts. And what we're planning on doing is, in the event that an area or a district becomes what the state has called yellow, in other words, with a high level of community COVID, we are looking to show that our schools are not the source and are safe to stay open. How do we do that? With a very, very simple test that's also an excellent test. We're going to be using the Binax now. This is the gold standard for rapid testing. It is better than 95% of a PCR test. That's the test that's uncomfortable and takes days to come back. This is a test that is not uncomfortable. The swab doesn't go past the lower nose, and we'll have the reassurance of knowing that the test is almost as good as the absolute gold standard test. This particular test is only available through New York State, and we're very, very lucky that the state has provided that to the school district for us to use.
Thank you. See, I told you that you want to hear from him and not this type of doctor, right? Okay, so let's do it. Again, I've been tested, just so you know, I've been tested 5 or 6 times with the way deep up your nose test, just because of the responsibility that I didn't want to affect an entire school district at times. So each step of the way I've been tested, so this will be a little bit different for me in that it's not the more obtrusive test.
All right.
I'm going to lower the mask because no way to do it without it.
That's right. All right. So, and just so you know, all the folks that are going to be coming to the school district are going to be, licensed medical professionals overseen by Dr. Milbauer. I myself am a PA by trade. We will also have doctors, nurses, PAs, and EMTs on site as part of your team. All right. All right. So ready? This is just going to tickle a little bit.
Okay.
All right. All right. So you're just going to. Perfect. So we just have to go in halfway up. Okay. And again on the other side. And that's it. It goes into the reagent, and it's a 15-minute process. We'll give the patient the results. We have a way of doing that through a HIPAA secure platform. All right.
Thank you.
All right.
Next.
Now our next contestant. Hey, how are you? What's your name? Joseph. Hey, Joseph. All right. So we're gonna play. This is a little game that we're gonna play. Now, if you laugh, you lose. You can't laugh because it tickles, okay? So it's going to be a quick little thing, just like the superintendent just did. You're going to put your good. And I heard you get a little prize after this if you're a good boy. All
Dad, you're taking the dinner tonight. I used to say friendlies. I don't think they're
Wow, you're so good at that. Did you do that before? No. All right, my friends. So that's it.